All right, 5 minutes after 11 o'clock. Thank you for tuning in. Lauren Debick is here. Lauren, as you know, is the manager of marketing communications at Ocala Health, and she always brings us some great guests with some great topics to talk about. And today, Diana Tully is here. And gosh, the more I look at you, the more I feel like we have met before. Diana is the genetic counselor for Ocala Health, and we're talking today about cancer, colon cancer, it looks like specifically. So good morning to Lauren, and good morning to Diana. Good morning to ladies.
Good morning.
Is it Diana or Deanna?
Diana.
Diana? Okay. Yesterday we had a Deanna, spelled the same way.
Yes,
right?
exactly.
So how are you both doing?
Doing very well, thank you.
Lauren, what's new? Anything new?
Lots of things.
We bumped into Brittany, I was telling you off the air.
Yes, you did.
Yeah, she didn't remember us, did she? What do? You do raise puppies? No, you don't raise puppies.
Raise puppies?
You just look at them.
I just look at them.
It was an off-air conversation. I kind of wasn't sure. I put the headphones on, then I'm in another world, and I forget where I am. Well, good morning.
Good morning.
Colon cancer just sounds so bad. I mean, and the word cancer sounds bad, but put the word colon in front of it, it's like, I mean, it has to be somewhere. Like skin cancer. I had skin cancer on my nose, a little tiny thing. The guy cut my nose open, and I could breathe so well. It was unbelievable how the air came right in. It's really true. And then he took care of it, and then I had to go into another room, and then they looked to make sure he got it all, and there was another guy in there, and he had bandages all over his face because I guess he had the spider thing happening. Mm-hmm. Does that happen with all cancer? But fortunately for me, the end of my story, I was done. So I don't mean dead, but I mean, he got it all. But does that happen with all cancers? Does it all spider out, like even in colon cancer?
Not necessarily.
No?
Most, pretty much, cancer is a million different types of diseases. So they don't.
That is crazy.
They all don't all behave the same way. But I think you make a really good point about people that don't like to talk about or think about colon and cancer. I mean, cancer in general, but colon cancer in particular. And I think it's really important that we have more awareness around the topic because it's fairly common and preventable.
Because, nobody ever gets heart cancer.
They do.
Oh, they do?
It's very rare. It's very rare.
So next time we talk to God, you say, would you please make the rest of us out of whatever you made that out of? If you can make my colon out of the same stuff you make my heart out of.
Mm-hmm. Pretty strong muscle.
I went for a laugh there. It got nothing.
Sorry.
It got nothing, Robin.
Yeah.
It got no. Oh, we'll edit that part out.
Well, when sometimes people have to go in for polyp surgery and have polyps removed, does that spark fear into them that they might have colon cancer?
I think people do get nervous when they have any kind of procedure or even have to think about cancer in general, but usually polyps are benign or sometimes precancerous, and unless patients have multiple polyps, they're usually not of concern from a genetic standpoint, at least. They can be removed and then they just move on.
When we were just talking to a heart doctor, and he was talking about increased risk of heart disease, and it sounded like the way to have less risk is to improve your lifestyle. Is that true with cancer too?
Absolutely, absolutely. So lifestyle and environment are probably the two most important factors in cancer development.
Okay, now when we say lifestyle, that basically means what we eat, right?
What we eat, whether or not we smoke, if we drink alcohol.
Okay, anything else?
Exercise, of course, would be an important one. Those are the ones I could think of.
So is it the same things, like the same things that help our heart help us prevent cancer?
Pretty much.
Now, you hear about people going in and having procedures done because they're afraid of the genetics, that they might have the same genetics as their parents or grandparents. Mm-hmm. How can you tell?
Well, there are genetic tests available that can help us identify which patients really do have an increased risk of cancer that's high enough for them to consider a surgery like that. Mm-hmm. The tests can be very useful. They're not perfect, but for patients who test positive, they can usually provide a lot of information. So, for example, if you think of ovarian cancer, if somebody carries a gene that puts them at high risk, once they've passed their childbearing years, they could choose to remove their ovaries and prevent that risk.
Really?
And do you try to dissuade them if they are in childbearing years? To keep their ovaries?
We don't really try to dissuade people in general. We really just try to educate them, help understand their specific situation, and help them to make a good choice for them. So if somebody is really, adamant and it's appropriate, and they don't want to have children, then and the surgery seems medically indicated, then we wouldn't necessarily try to dissuade them. But some people do get overly anxious and try to think about things that are probably beyond what they need to. So I think most people think their risk is higher than it actually is. And so a lot of times we're sort of talking them down a little bit and trying to put that into perspective.
Wow. Your job is half psychologist, I think, sometimes.
Sometimes.
All right, we have a phone call, and if you have your headset on, okay. Diana Tully is here. She's going to answer whatever question you have, unless it's for me, and then I'll answer it, whatever you want to know. Good morning. Thank you for calling and for waiting. You're on the air with Diana Tully.
Dr. Larry, I have a question.
What is it, sir? What can I help you with?
Are you taking care of yourself and having your regular examinations?
I'll let Diana answer that. Diana, am I?
The question I have is, my mother-in-law, she just reached 75 here not long back, and she's always been going every 5 years for her rectum tests and stuff, and everything was normal. And the doctor says now that you've reached 75, there's no longer a need for you to have the annual or the every 4 or 3 or 4 year tests anymore, because you're at an age where we're not concerned. And would that be general for most people once if they had no problems in their life and they reach 75? That they don't have to go for their tests?
Yeah, doctors do think about other competing risks. So, and no procedures without risk, and colonoscopy is generally the screening procedure used for colon cancer prevention and surveillance. So, if someone were to develop a colon cancer, the odds at that age, the odds are that it would grow slow enough that it wouldn't be the cause of any major illness or concern for them before, unfortunately, something else might happen. And so they think about average life expectancy and the risk of the procedure, and they do often discontinue certain screenings that have some risks after a certain age. So yes.
Basically, what kind of a risk would you have with that procedure? I mean, would they tear through the lining or something, or something worse than that?
That's very rare. That can happen, but it is one of the more rare side effects. Colonoscopy is a relatively safe procedure. It's done routinely every day in the hospital and doctor's offices, but it is possible that there could be a tear or a puncture or an infection or something of that sort.
Okay.
Okay, thank you.
Thank you for the call. By the way, the phone lines are open. If you want to call, the number is 622-9622, and we'll be glad to answer your questions. One of the things I wanted to ask Lauren to address is the phone number, because I often wait till the end, and I've had comments, not complaints, but comments saying, could you mention the phone number more often? So I'm going to ask you to do that.
Absolutely. So the number for our physician referral hotline is 1-800-530-1188. So if you do have additional questions about this, if you would like to gather some more education, some more information, you can call that number. Again, it is 1-800-530-1188.
And do we call that number first, like for the genetic testing part of this? That's what I'm confused about. Do we get genetic testing? I don't know who wants to answer this. Let's say we don't have any reason to believe there's anything wrong. Do we still get the genetic testing?
No, usually patients are sort of flagged by their providers, so their physicians, if there's a young age of onset, if there's a family history of multiple affected individuals, if individuals have had 10 or more polyps. So there are certain risk factors, certain red flags that would indicate that patient should consider having testing.
What causes the polyps? Is it spicy food?
I wish we knew that.
Oh, we don't know.
Oh.
I thought you were going to say, I wish it was.
There are a number of factors that are known to increase polyp risk. One of them is smoking, diet, but essentially there's a lot that remains unknown. Isn't it funny how smoking does it? Because
smoke doesn't get there.
Not directly, but indirectly.
No, indirectly?
Yeah.
It gets into the blood?
Secondhand smoke too, probably.
It gets there,
I don't know about studies on secondhand smoke, but definitely we know that smokers have a higher tendency to have a polyp on their first colonoscopy.
Does
Really?
Does insurance cover the genetic testing?
Very often they do, if it's medically indicated, so similar to any other medical test that a patient might need, as long as there's a medical reason for it. The insurance companies do see the benefit, because if we can identify the risk and we can mitigate the risk or find cancer early or prevent it altogether, it's going to be a significant cost savings.
Oh my gosh.
So Lauren provided us with questions, and there's one on here. Can I ask this real quickly before we go to the break?
Sure.
Can my genetic test results be used against me? How is that?
That's one of the common questions that we get. So a lot of patients are concerned that they might not be able to get health insurance, or they might not be able to, they might not be
okay, in that way.
employable if they have some kind of predisposition. And so we do have actually a federal law that prohibits employer discrimination in employment and discrimination in health insurance. So there are some protections in place, and some states have additional protections. But I always tell each patient that we think about any potential risk and any potential benefit and try to weigh those out. And usually having the information and potentially saving a life or the benefits outweigh the risks of actually having the test.
Wow. The phone lines are open, by the way, if you would like to call. We'll take a little break, and we'll be right back answering questions about colon cancer and health in general. You're welcome to call about anything. Lauren Debick is here from Ocala Health, as is Diana Tully. And we'll take your calls on the other side of the break. The number is 622-9622. We will be right back. All right, 18 minutes after 11 o'clock. Just take a look. Just hold on. Look at that beautiful day. This is the day you want to play hooky, right?
Yeah.
Just
Absolutely.
go do something. I mean, wouldn't you want to go to the beach today? Are you like going to the beach? The salt water's okay for you, right?
Absolutely.
Health-wise, right? Let's get back on topic. The phone lines, by the way, are open. Lauren Debick is here from Ocala Health, and she has invited Diana Tully to be our guest this morning. We're talking specifically about colon cancer, but we kind of went into this very interesting aspect of that, which is the genetic testing aspect, right? So how do you do that? I mean, is it, and Lauren, that was a great thing to come back with. How do you, you use a cotton swab? What do you do?
There's a couple of different ways that you can do a genetic test. So the traditional way is on a blood sample, but we can also use saliva or buccal samples, like you said, a cheek swab type
Buccal
test. The blood samples are usually the most robust way to make sure you get a good sample.
What does it tell you?
You look at different genes to look for any sequence changes that might suggest the gene's not working. And so there are several genes that we know are associated with colon cancer risk.
That is amazing that you can see that. Now, when you see like pictures in a book or on the internet of DNA, it's got that little roller coaster looking thing, right?
Mm-hmm. The double helix. Yep.
Yes.
I'm an 8th grader. What do I say? The double helix. Thank you. Is there a roller coaster called that? I think there is,
the
right?
double helix.
The double helix roller? I think there is, right? In
Yeah,
Six
I think
Flags?
so, yeah.
I never knew that's where you got it there from. All right, so that they can actually see that?
Well, they look at each individual molecule all along the DNA strand to see if there are any changes than average, and then they look for big missing or extra pieces of DNA that
bet
could
I got some missing
interfere
pieces.
with the DNA function.
I would love to see what mine looks like. Wouldn't you like to see? I don't know what it would mean. Can they fix that or no?
Right now, no, but there are a lot of interesting studies and new methodologies that are being looked at. So
Really?
It's possible that in the future, more so they're trying to target therapies towards individual findings.
Oh, yeah?
So, different medications that would help.
So they see now. Do they hold that up against? I don't know if I'm asking that right, but do they the information they get from that? Do they hold it up against, for lack of a better way to ask this, with your parents' history? Do they say, well, does this match up with them?
Well, not necessarily. So in the laboratory, they actually compare to what they would call the normal or reference sequence and look for anything that's unusual. They don't necessarily compare to parents in this type of setting. But then if we do find something, it often makes sense to test parents and other family members to see which parent it was inherited from and who else in the family might be at risk.
And does it matter if you're male? Do you inherit what your father had, or could I inherit what my mother had?
Half of your DNA should be from your mother and half from your father.
I should have known that, right? The way she's looking at it. I should have known
but it's
that.
a very good question, because especially when you think about things like breast or ovarian cancer.
Right, that's what I'm thinking.
People think
yeah.
they can't inherit that type of risk from their father's side of the family when they very well can.
Just interestingly enough, this is today's news, right? And the headline says, human DNA editing to prevent serious conditions, a future possibility. And that's from Science Magazine and the Reuters news agency.
It's probably about CRISPR, right? Or
CRISPR?
It's a new technology.
Isn't that a new taco at Taco Bell?
It's a new taco.
You're right, it is. It says a new technology called CRISPR Cas9. Is that right?
Yeah.
Wow, you're on top of it. Do you
try.
Do you want the
I
article?
try.
Wow, that's amazing. Here, but and we didn't even get to that story this morning, but now I had a chance to use it. That was this morning's news. Isn't that amazing?
That's the new exciting thing in genetics that everyone's really talking about and really hopeful for.
We're going to live forever one day. There was a story the other day. I know this is completely left field, but there was a story about growing organs inside of pigs. Isn't that amazing to you?
It is. I haven't read that story, but it's amazing what we can do with stem cells.
Yeah,
So to not have to wait for a transplant, but to
cool.
regrow a new heart or regrow a new liver for someone would be
Here's
amazing.
the coincidence with this. Robin is from Cudahy, Wisconsin. This weekend they're having a bacon fest. Isn't that amazing?
What can I say?
All right. I know we have a serious topic and we're having fun. All right, let me go to
Gotta have fun too.
Let me go
That's
to. I heard that
Urban
fun
BLT for lunch
is healthy.
today.
I heard that laughter is healthy, right?
Absolutely.
Yeah.
That's why I try. I try to make everybody healthy. Good morning. You're on the air. Thank you for calling.
Good morning. I was wondering if you can see markers for other kinds of cancer, like ovarian cancer, as well as the colon cancer, when you do these buccal tests. 'Cause
Absolutely.
There's some that seem to be so subtle by the time you have them, it's too late,
Right. And ovarian
And thank you for your time.
Yeah, absolutely. My pleasure. And ovarian cancer is one that we do focus on a lot because a significant number of patients who have ovarian cancer actually will test positive for a gene mutation. So any type of cancer potentially could be inherited, or the risk could be inherited. And the more rare the cancer, the more likely it is that it has a hereditary component. So in general, cancer genetic counselors will look at any type of cancer and look for patterns of cancer in the family and talk about individual genes and what cancer risks are associated with them. So some of the colon
Really?
cancer genes actually are associated with ovarian cancer risk as well.
That
And
sort of answers the question I wanted to ask. Is this, and it goes back to the mother, son, father, daughter thing. So if your father had prostate cancer, does it manifest itself in the daughter, or if the mother had ovarian cancer, does it manifest itself in the son as something else?
It could. So if the gene is present, the genes are present in every cell of the body. So depending on which organs they're active in, there are certain genes like BRCA1 and BRCA2 that are important for the female breast, ovaries, in men, the prostate. And so a woman might have a risk of breast and ovarian cancer, obviously wouldn't have a risk of prostate cancer, but if she carried that gene, she could pass that gene mutation on to her son, and he could be at risk for prostate cancer.
And is that where genetic counselors come in? I mean, the patients actually talk to them, and then they're the ones that figure out what percentage that someone would have to have a risk of different cancers?
Right, that's exactly what we do. So risk assessment is a significant part of what we do. And then we help patients to understand who else in their family might be at risk and for what, and then help them communicate that to their family members.
So that's what you do. That's your job. Wow. What is that like in that room? I mean, are people scared, and do you make them less scared?
Sometimes people feel empowered usually by the information. Most people are scared in general. So if a woman's had a mother with ovarian cancer or breast cancer, they often feel like they're definitely going to get that cancer. And so sometimes the information we provide can be really reassuring. We get to give good news a lot of the time. And sometimes people are just looking for an answer. So if there's a strong family history of cancer and we find something, they often are very grateful that we finally know why. And then we can do something about
I'm
it.
just curious, in your job, when a news item like that I just showed you comes out, do you sometimes wish they wouldn't release that news because that's maybe 10 years in the future? I mean, is it too soon for us as lay people to know that that's around the corner, even though the corner is 10 years away?
I think it's important that they release it. I think it's interesting, and I like to stay on top of it myself. I find that a lot of these things, unfortunately, don't come to fruition, and that can be disappointing,
At
or
all?
they can take years to
Really?
come to
Yeah.
fruition. And some of them are, exactly what's going to happen next. So I don't think it's a bad thing that they advertise them, but it can lead to a lot of questions that can be challenging to explain to patients who are, sort of chomping at the bit for an answer or something that they can do.
Are people doing that now when the babies are born? Doing, withdrawing blood or something and putting it in for genetic testing?
Usually only if the child has a problem. So we're not doing general genetic testing for, healthy individuals just yet. I think that's coming down the pike.
Oh.
So usually there's some kind of indication for testing, like a
Down the
history.
pike.
Yeah.
See, she's from Long Island. I remember that expression too. Did you ever have a dining needle land on you?
A what needle?
A dining needle?
No. What is that?
Oh, she doesn't know what that is. That was a little dragonfly on Long Island.
Oh,
And
okay.
I read it was the only place in the whole country that called them dining needles. The rest of the country calls them dragonflies.
Oh, I would think of it as a dragonfly. I haven't heard that term. That's so funny.
All right, so the one question, I guess this will probably be my last question. Do the family members come in for counseling, genetic counseling?
Very often they do. So if they're nearby, a lot of families like to come to the same genetic counselor. They feel comfortable. We already have the information. But if they're not nearby, we generally refer them to somebody who's qualified in their town. So families will live all scattered throughout the country. So we'll help the family members find somebody, say, in Ohio or Wisconsin or Long Island or wherever they're from.
Yeah. Two reasons. One, because you're related, so it might apply to you. And then the first reason is because you love that person. That's the person you care about, right?
Right.
And what's really amazing is that people are more apt to talk about things openly these days. They're not shy, and they don't look at it as something that's terminal, because they have all of this information at their fingertips. They have people like you out there, Diana, that make other people that might have this situation at ease. And I think that form of communication and your manner is really helping along.
There was a very long period of time, not that I've been doing this forever, but I've been doing it for quite some time, where it was very hard to get a lot of family history information because people didn't talk about cancer. They didn't even tell their children they had cancer. Sometimes the patients themselves didn't even know they had cancer.
Yeah, I would think just a few generations back, they might have died of colon cancer and had no clue.
Or they'll tell, or everyone will say it was stomach cancer.
Oh.
So colon
Okay.
cancer, uterine cancer, ovarian cancer.
Right,
If you
right.
really track down the records, the family might not have it right, so you got to keep that in mind when you're doing the assessment.
I think information is always good. And Lauren, thank you for bringing us some. You must hang out with some smart people.
I absolutely do.
You must be smart.
I think she is
I think
very
if
smart.
we ever have coffee together, we would. I would have to tell you jokes. I don't think I'd keep up with anything. Thank you for coming in here and helping us with this. So let's make sure that the listeners can get more information. Lauren, again, the best phone number is what?
1-800-530-1188.
Okay. Lauren Debick, thank you for coming in. Diana Tully, thank you for coming in.
My pleasure.
Next
Thank you
time
for
I'll
having me.
remember we've met. We have met.
I
right?
think we did.
I think we did, too. You look very familiar. Does she look familiar to you, Ron?
Yes, very
How
much
come my
so.
music isn't playing? Oh, the music is coming up. Thank you, ladies. I thought it was later than it is. Watch this. 3, 2. Watch this, Lauren. 3, 2, 1, go.
It's magic.
There it is.
Thank you so much for having us.
Thank you. We'll be right back.